Hello, I'm Dr. Frances Pitsilis. What questions should you ask when you're considering a dermal filler cosmetic facial treatment? Well, what's important is that the person about to inject you knows what they're doing, that the treatment is appropriate and safe for you and your current state of health. Dermal fillers have been around for more than 20 years. They started off as bovine collagen, which is collagen from cows, and then they became more predominantly human collagen. But the life of this treatment expired after we moved on from just lining the lips to using dermal fillers for volume in the middle part of the face. So no longer do we just want to line the lips and get a few of the lines around the mouth. We want to give more volume to the lips, and we want to have more volume into the face and to help contour the face. So as a result of that, we tended to gravitate more to the hyaluronic acid dermal fillers. These have been around for more than 20 years, and one particular brand has been used safely in over 20,000 people. There is a tiny allergy rate of 1 in 2,000, which is very good. So it's quite enticing to think that you could come and have a dermal filler as a lunchtime facelift and walk out of the clinic looking and feeling better. But what questions should you be asking? Many people ask us about permanent fillers and how long do these dermal fillers last. The hyaluronic acid dermal fillers, which are largely used, last anything from 6 to 18 months, and they do a lot better if you have a top-up at the 6 to 9 month point, and you're more likely to get 18 months out of it. It's a good thing to keep going because in 10 or 20 years, if you have been having dermal fillers, you're far better off than not having had dermal fillers because hyaluronic acid stimulates collagen production. People also ask about permanent dermal fillers, thinking that it might be more economical and practical. The problem that we have with these are that your face changes around them as you age and then they look inappropriate, and also they have an increased risk of causing painful red lumps and infections and lumps that we call granulomas, which are not a good thing. So when you see your injector, you should ask, is this treatment right for me? Are you knowledgeable and experienced about this treatment? You should ask, if it's a nurse, where is the doctor and do you have emergency equipment and medical support? Now, there have been some unwanted outcomes, but generally this treatment is very safe. It's very important for your injector to know whether you have health problems. So they should administer to you a questionnaire that asks you about all of these health problems and information about what could go wrong. That's called informed consent. You need to know what could happen and what the risks and the benefits are. Generally, the benefits far outweigh the risks. Does your injector give you their after-hours number in case of problems? Does your injector give you specific information about what to look out for that may go wrong? This is particularly important if this is your first time. If you're a seasoned receiver of these treatments, you will know that the main side effects can be swelling and bruising. The good thing about our clinic is that we have a gentle laser that can get rid of the bruising very easily. But you just need to know about anything else that's unusual just in case. What's very important about potentially serious side effects, and these are very rare, is the potential for a blocked artery or if the dermal filler is put in the wrong position, it may threaten your eyesight. So this is why we need people to be in a medically solid, safe, professional and environment so that they don't have any of these problems. Dermal fillers vary in their consistency, softness, texture and ability to lift the skin. An experienced injector will know which types of dermal fillers to use in which part of your face so that you get the best and appropriate results for what you're trying to achieve. In our clinic, both my nurse and I inject, and when my nurse is injecting, I'm always on the premises. If you're about to be injected by a nurse, I think you should always ask what preparations the nurse has in case of any emergency. Are there any long-term risks? Not really. These treatments are generally safe.